So, so, um, you know what? I need to know. Though again, what's your last name, Ruby? That's a barrier for communication, isn't it?
Tovich. It's Tovich. Hey, my last name is Tovich.
And is the right hand the hand that you sign the most with? Then we'll put this on the left hand. Okay, so, Mr. Kurtovich, you're here with chest pain and shortness of breath and palpitations, is that correct? Okay, when did this start?
I don't know, yesterday? About yesterday? My chest pain started. And it got worse. And it went down my arm. And it shot down through my leg as well. And it was really hard to walk. So I would have to sit down.
Sure. Have you had this problem before?
No. No, I haven't. It's the only time I've ever had this problem. That's why I came here.
Well, Mr. Kurtovich, it's important that we check your heart. And to do that, we're going to get a test done right away called an EKG. And I'm going to call for one right now by signaling with this call light, which we'll keep on this side of the bed for you, which you can use to call for a nurse. But I'm calling right now. You need an EKG for the mock patient in here?
Okay.
So that we can check your heart rate and rhythm. And we've already got you on our heart monitor, which shows you have a heart rate of about 89. And actually that you're in your regular heart rate, which might be normal for you. Have you ever been told that you have an irregular heart rate? Or atrial fibrillation, it's called.
No, I've never been told that. I always thought it was normal.
On a scale of 0 to 10, how would you rate your discomfort? 10 being the worst and 0 none.
I'd say I'm about in the middle, about a 5. Yeah, like right in the middle, about a 5.
About a 5. Okay. Did you take an aspirin today?
Yes, I did.
Was it an adult size aspirin or baby aspirin?
I don't know, it's a regular aspirin.
Okay. Well, we've got oxygen on you because oxygen is important for your heart. And we were going to check your blood pressure, so I'm going to start that up now. Your oxygen level on the sensor though is good. The other thing we'll do is we'll get a quick reading of your heart. There we go. Do you really want to take off the shoes? You're going to be here a while, so you might as well get comfortable. Whenever we have chest pain, we do lots of different tests, and those do take a few hours. So, do you have any heart history, any medical problems I should know about? Nothing. Besides aspirin, what medications do you take?
None, I don't take any other medications.
Okay. So your pain's about a 5, you said?
Yeah, between there. About
We're gonna get the doctor in to see you, and he's gonna assess your pain, and then we're gonna see about getting that pain to go away. Have you had a cough? Are you having any chest congestion?
Yeah, I've had a cough.
Okay, well then we should check your lungs and see. Maybe this could be related to that. So we'll listen to your lungs. How about if we get you to sit up a little bit? There you go. Take some deep breaths here. Okay, good job. You can lay back. So I'm going to get this information out to Dr. Foley. And EKG will probably be coming in the meantime. Here they are.
Oh, good.
Okay. Any short of breath with it?
Yes.
Anything seem to make that worse?
No, it just hurts. Like, it goes down my arm, and then it goes down my leg. You know, my breathing's a little off.
Okay. When did that start?
Yesterday. About yesterday. And then it continued on.
How are you feeling right now?
I'm okay. A little weak. But other than that, I'm
On a
okay.
scale of 1 to 10, what's the pain?
I'd say about in the middle. About like ranging from a 5.
Alright. Ever had anything like this before?
No. It just hurts. Maybe before and I don't know. And then I can't remember, but that's why I'm here.
Now you're here.
Yes. Now I'm here.
Good. Any other medical problems?
I take aspirin. Like, I took aspirin. Other than that, no.
Good. Any asthma or diabetes or high blood pressure?
No? None of that?
Good. Do you smoke?
No, never. Never smoked.
Excellent. Is there any family history of heart problems?
Oh, yeah, my mom. My mom had heart issues. A lot. It was she had like an inflamed heart, or like a swollen heart. And there was like a valve that wasn't right.
Well, on your electrocardiogram that they just got, it looks like you have atrial fibrillation. And that's where your heart is beating irregularly. It doesn't look like you're having a heart attack, which is good.
Oh, I see. Okay.
We're just going to look you over a little bit and then
Okay, that's
figure
fine.
out what we need to do, okay?
Yeah, okay.
All right. Can you open up? Grade me. But I'm trying to look at two people at the same time.
Right.
Can you sit up? Big deep breath. Good. Just breathe normally. Give me my back. This one through here.
No.
This one up through here.
No.
Good. Just gonna feel your pulses. Ever get swelling down the feet?
No.
Sore there? Excellent. Alright. We're going to do a little bit of blood work, and then we'll figure out what to do.
Okay, fine. That's fine.
Most women are at risk for developing osteoporosis.
So I went to the doctor, and then I waited and I waited for a long time. And when I finally got in, I was overwhelmed. I had to go to the pharmacist and pick up medicine.
Okay.
But I want to know, about my sister. There's a few different things that, I was kind of curious about. About 5 years ago with the medicine, she kept taking different medication. And now, she's gone. And, she had, brittle bones that she would take to prevent that. And it would kind of stop it and quit making it worse.
Is it osteoporosis that she had? Did you think that's what it was? Osteoporosis?
Yes, I think that was it. Yes, right. But I don't have it. I can't have it.
Most women are at risk for developing osteoporosis. It really does not have anything to do with the cancer that she had, although that could have made it worse. But women are at risk for osteoporosis, which is a condition that makes your bones more brittle. And that puts you at risk for breaking hips and small fractures in your vertebrae, which are very painful. And the reason that women are, yes, what happens is
to shrink?
Women that have osteoporosis tend to shrink because their vertebrae, there's fractures and they shrink down in size, and it's a painful situation.
So what can I do? What helps it? What can I do?
Yes, there is. As a matter of
Is there
fact,
anything I can
it's
do to help it?
calcium. It's just over the counter. You can buy calcium with vitamin D.
That'll help with my bone structure?
It's either not drinking enough milk or getting calcium from other sources in your diet. You don't necessarily have to get calcium from milk, but most people don't get enough calcium in their diet. And so, especially women, and as I said, the reason that women are prone to osteoporosis is because your bones are less dense to begin with than males. And so men do get it, but at a much lower rate than women. And so what you should do is if you're not drinking 3 or 4 full glasses of milk every day, which I know I don't, then you should supplement your diet with calcium tablets with vitamin D, because the calcium with vitamin D is more effective than just the calcium alone.
So what if I can't drink milk? If I take the vitamin D tablets, I don't, you know, because I can help my bones.
Yes, that will help. Sometimes it's not enough, the calcium alone. If someone has active osteoporosis, and your doctor can actually run a test and do a scan on your foot, you just put your foot in a little, like an x-ray machine. It's called a DEXA scan, and they can tell if you have osteoporosis or something called osteopenia, which is kind of the step before osteoporosis. If you actually do have osteoporosis, then you should be on additional medication. If you don't have osteoporosis, it's still a good idea to take the calcium with vitamin D because that'll help prevent it down the line. So what I usually recommend to all my patients who are women that are not drinking a lot of dairy or getting a lot of calcium in their diet, even when they're young, is to take calcium with vitamin D every day. Because even if you do not have osteoporosis, you are at risk of it simply because you're a woman. And taking the calcium will help prevent that.
So if I go get the medicine and have them, you know, if it's new medicine, and I have it labeled, and I have all these different kinds of medicine, I have to make, you know, new medicine.
For calcium? For the calcium?
So I need this label for calcium. Oh, I understand now. You know, I gotta write this down. You know, I need it big letters or else I can't see it. So will you, so I understand I would need to write
What we
down
can do, calcium does not require a prescription. I can just sell you a bottle of calcium, but I could actually write on the bottle that it is for strong bones or whatever would help you remember why you were taking it. Now, do you drink milk at all? Or eat a lot of cheese?
Oh yes, I drink a lot of milk.
3 or 4 glasses of milk a day?
Well, in the morning, afternoon, and night, you know, I'm sure I can drink 4 or 5.
Then you may not need to take extra calcium. You may be just fine.
Well, I'm not sure if I need to drink, you know, more water, more than milk, you know? Like, why do I need both? It's important to drink water than milk, isn't it? The water helps keep cleanse my body. You know, you understand?
I think that you should drink enough water so that you're not thirsty. I don't think you have to go overboard with drinking a lot of water. But I think if you're concerned about osteoporosis, you should, when you see your doctor the next time, ask your doctor, and they could do a screening on you and tell you if you actually do have it or you don't have it. Sure.
I would feel okay. I have this weird, this weird thing right here. I have a problem swallowing pills. That's no good right here. Like, I don't want to throw up or anything if I, take it too fast or, So I need to ask my doctor, if I have this.
Absolutely. It's a quick and easy thing that they can do to determine it, and probably a good idea at your age to check.
I'm 87 years old. You can see that I'm old.
Not so old. Not so old this in these days.
I feel strong, and I work a lot and all these different things. I try to stay active the best that I can. Like, I don't want to just sit around and be lazy. I want to be quick. I want to keep feeling young. I don't want to feel old.
Absolutely, and that's why it's important that you keep your bones nice and strong, right?
Oh, what about my hips? What about my legs? Like, I'm worried about that. I need to keep those bones strong too. What happened? Like, what about my hips? Like,
why do the hips? It is the place that people will have fractures, and it's because there's so much weight bearing on those hips, on that hip joint, that it will break. Sometimes people fall and break the hip. Sometimes the hip breaks before they fall. It's hard to determine sometimes, but because there's that weight bearing on that hip joint, it tends to fracture there, or they fall and that's where they fall.
oh, I see. Thank you.
You're welcome.